Hello, and welcome to the AAMFT podcast, your all-access pass to the latest news, developments, and thought leaders in the world of systemic therapy. We strive to relate, educate, and innovate, one episode at a time. I'm your host, Dr. Eli Karam, and we're brought to you by the American Association for Marriage and Family Therapy. Our podcast explores topics that relationship-based therapists care about. In addition to featuring unique conversations and interviews with established experts, our show provides information and education on direct practice and emerging trends in the MFT profession. For more information, please visit us at aamft.org. Thanks for listening and enjoy the show. Welcome back to the AAMFT podcast, All-Star Panel Edition, a celebration of the visionaries and innovators who have defined systemic therapy across the generations. These conversations capture the wisdom, humanity, and deep relational spirit that continue to move our great profession forward. Today's All-Star Panel features three legendary figures whose work has profoundly shaped the practice of systemic family therapy and influenced how we understand resilience, culture, and healing from trauma. Dr. Froma Walsh, Dr. Celia Falicov, and Mary Jo Barrett. What a panel. Froma Walsh is the co-founder and co-director of the Chicago Center for Family Health and a professor emerita at the University of Chicago. Widely recognized as one of the foremost family therapy scholars of our time, her pioneering work on family resilience and spiritual resources in family life has become foundational to our field. Froma's writing, including Strengthening Family Resilience and Normal Family Processes, continues to guide clinicians and researchers in understanding how families thrive in the face of adversity. Dr. Celia Falicov is a clinical professor in the Department of Family Medicine and Public Health, the University of California, San Diego, and a past president of AAMFT. A global leader in cultural and contextual family therapy, Celia's contributions have transformed how clinicians integrate culture, migration, and identity into their work. Her seminal texts, including Latino Families in Therapy and Cultural Perspectives in Family Therapy, have set the standard for culturally attuned systemic practice. And last but not least, Mary Jo Barrett is the founder and director of the Center for Contextual Change in Chicago and one of the leading voices in trauma-informed systemic therapy. Mary Jo is a co-developer of the Collaborative Change Model, which is an integrative framework for treating complex trauma, abuse, and relational betrayal. Known for her authenticity and compassion, she's trained thousands of therapists around the world in how to bring safety, structure, and connection to even the most painful of human stories. Together, Froma, Celia, and Mary Jo represent the heart of systemic therapy, resilience, culture, and compassion in action. Their collective work reminds us that healing is not just about reducing symptoms, but restoring meaning, connection, and hope within relationships. Let's dive into this powerful conversation. So happy to be joined here on our all-star panel, all-female all-star panel. These are three of my most requested guests in previous seasons of the podcast, and they have a lot of respect and care for each other, so this should be great in our talk today. I'm starting out by asking everyone, all our all-stars, if you were to describe how change happens in systemic therapy to someone that had never been to therapy or someone that was just going to enter a MFT or a systemic therapy training program, how would you describe change, how it happens in therapy?
Well, the first thing that comes to my head, and I was thinking when I was thinking about this, how we each are going to so answer through the lens that we've finessed over the years. And my belief is change happens in relationships. It absolutely happens about collaboration and people, I think in terms of that the relationship is not just between the people in the family, but also between the therapist and the clinician. And so I believe for me, it happens with, if we're going to get really concrete, it happens with the collaboration. It happens with transparency, with, in my experience, having the client be the expert, as we all talk about in their own lives, and that it is not something that is done to somebody. It's done with the family and with the couple. And so to me, it looks very different, even with a similar thread. It looks very different depending on each family and what their resources are and what their vulnerabilities are. And um, so it happens in, I don't, I'm sure I'll have more to say, but that was the first thing that came, that it really happens on creating the relationship where everybody is sharing goals and sharing intentions.
You know, what popped into my head was actually something that I think the privilege or benefit of having Carl Whitaker as a supervisor. And that he used to come to IGR where Mary Jo knows well what it is, and so that's Froma because it's in Chicago, the Institute for Joint Research. And that there was one time where myself and a co-therapist were interviewing a family in front of him. And that the family at some point said, the father said, I think I have changed, because it was traumatic. I think I have changed through coming here. And so Whitaker then asked him, he was just present, listen, asked him, so how did you change? What is it that changed? And the man thought about it and started, I get up in the morning and I look at myself in the mirror and I realize that I have always parted my hair on the left side. And that now, through coming here, somehow one day I looked at myself, I said, why shouldn't I cut it on the right? No? Whitaker got up and said, shook his hand and said, these ladies have a PhD, but you have a greater PhD. And I think he was talking about the continuum between flexibility and rigidity, because this was a family where the parental unit was very rigid. And this man was a cleaner in bathrooms at schools, and he was very upset whenever the children left something out of place or they hid something under the bed. And as I think the continuum of flexibility, rigidity, is one of the ways, the processes by which people change. I don't know exactly what happens in therapy that allows that to come to the fore. Can I do this in a different way? Can I behave differently towards my family or towards the world? So I think that's an important element of change.
Froma, what do you think?
Yeah, I love your reflections on it. And I think there have been too many debates about, is change internal or is it behavioral? And then we have cognitive behavioral. And I think one of your questions is what distinguishes all of us. And it's this systemic approach where it's multi-level, and it always needs to be, so that it isn't just what happens in the room or what happens in the way I think about things, but also it's what I do that's different and who I do it with. And it's that relational piece that's with those who are most intimate and most loved and cared about. But it's also then a wider sense of connectedness with others that expands the consciousness, so that we don't just change the behavioral problem or the symptoms that we have. That's where growth occurs, I think, in therapy, is when our consciousness, our behavior, our circle of people we care about and depend on mutually, as that expands, to me, it's most satisfying.
As you both were talking, all of a sudden it hit me on that when I've done over the years, and I think I mentioned this, Eli, in the first podcast, but we've done the qualitative interviews as people leave. Jen, and when you said, Celia, about Whitaker asked the question, we've asked that question we ask it at the end and literally tape what people say, audio tape. But I've also been fortunate enough that we've interviewed people. I got to interview my very first client that I ever had 40 years after I saw them.
Wow.
Yeah, it's
What was the context of that?
the context was we were following up on a 6-month, 5-year, 10-year with students from U of C and Terry Trepper from Purdue. We were just following up. And I thought, why can't I look for the blah, 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 the family? And we found them and interviewed them. But what I was going to say is, which hooks to everything we've already said, is that we really did distill it. And I don't know why I didn't think of this when you asked the question. We distilled it to 5 ingredients from all the different interviews. And we've had about thousands of interviews at this point. And we just took what they said. And the major thing, obviously, was the relationship. But the first piece was the connectedness, that they felt a connection not only to the clinicians, but they felt a connection to the family, the members, having that reconnection. But they also even talked about feeling connected to receptionists or people, that they just felt a connection in that process. They also talked about feeling valued, that it was their expertise, which hooks into what you were saying, Celia, their expertise, that the clinician valued their contributions as much, if not more. The other thing they said was the psychoeducation, which then hooks in to what you were saying, Froma, about behavioral changes, is that they said they learned things. They absolutely learned things about being in relationships that they wasn't in their toolbox. And they said, and this was something across the board. And when I'm training people, and I always say at the end of a session or they check in, so how was it for you? And they said hope, that the process of therapy instilled hope in them, and without the hope, they couldn't have changed.
Yeah, you're hitting all of these common factors. I've spent the last 2 decades of my career studying. You're talking about the relationship, and that's how you said people change, through relationship with each other. And when you think about relationship, you think of the therapeutic alliance. So let's rip off that and you think about one of these extra therapeutic factors like hope, which we'll talk about today. I asked you all to think about what makes us, as systemic therapists, MFT, CFT, family psychologists, whatever you want to call it, what makes this different than a more individual therapy? And one of these things is the nature of the therapeutic alliance. When you're thinking systemically, it's so much broader. If I'm working with a couple, I have a relationship, an alliance with each member of the couple together has an alliance with me. And the dyad has an alliance with each other outside of me. So when you have more than one person in the room, it's inherently more fascinating, I think, more complex. But let's talk about building alliances, and what you all have learned over the years is that as those clients told you 40 years later, Mary Jo, that the relationship mattered. Let's talk about how you all build therapeutic alliances, the way you naturally do it.
It was systemic therapy, so relational therapy is connecting with each person. We certainly learn how to do that in family therapy and in couples therapy. one of the fundamental parts of it to create a safety environment is not to side with anybody for quite some time, or not to side consistently with one person. And I usually start in family therapy and in couples therapy by saying that, by saying, I'm not a judge. I'm somebody who might see things that are positive or are benign, and some other things that may not be, in my opinion. So I might voice that opinion. And so from the very beginning, I'm very transparent about the possibility that the multiple voices in the room will be heard. And I think one can stretch that and do it in individual therapy too, if you think of multiple voices. But the reality is that we have something very concrete. We have people who think differently from each other, who sometimes think the same as another, and sometimes they don't. And so creating what I think have come to call it cultural safety in the room, it's a very important way of creating a therapeutic alliance, which without it, we know that the situation will not healing or safe for people without feeling that everybody can speak their mind and the therapist will hear it. I think a lot of systemic therapy is about validating the multiple voices.
Yeah.
I absolutely agree, Celia. I mean, that the transparency is the most essential ingredient in my experience. And also, and again, I realize my lens is so much based on trauma, and even more specific on family violence.
Right.
So one of the things that I really work hard at is to make sure the therapy is not something that is being done to someone. Because particularly if you've been abused or neglected as a child, that is what abuse is. Abuse is in the family at home, is that a person in a position of hierarchy and attachment is doing something to get their needs met and is doing something to you. And so look at what the clinician is. We're in a position of hierarchy and attachment. And so to me, such a crucial element is that I'm not doing it to them, that I'm not in that position. And even though I'm aware I can't completely flatten that hierarchy, it's just going to be there. But that consciousness of hierarchy and attachment, which is then the other thing that I think is important for me about forming a relationship, is being very aware of what my resources are. Like, I remember, I think it was Whitaker, Celia, because he was still at IJR when I was there. He was coming to IJR. I remember so many things that he said, obviously, or so many experiences more than even things he said. One of the things that I remember him saying was, you're not supposed to become little Carl Whitakers. This training is not for you to be me. And so to me, what's important in that relationship is, what am I as a clinician? What are my resources? What are my strengths when I'm in a relationship with someone? And when you said, Eli, about the family 40 years later, the two of the things that reminded me is that I said to them, because don't forget it was my first client, and I said, did you realize back then that I had no idea what I was doing? And they laughed and said, yeah, that was obvious that you had no idea what you were doing. And I said, but you kept coming back. And the three things they said, one is, we were mandated by the state, so we didn't have choice. I was like, okay, fair enough. But the other thing they said was, we knew you were getting good supervision. And I thought that was fascinating, because I had the guts back there to say, you know what? I don't know what's happening. But they said, you would tell us I'm going to talk to my supervisor. And when I came back, what I said or did, they felt was helpful. And back in those days, we were getting live supervision. And so they knew that piece that they knew even if I didn't know what I was doing, that I cared enough and was invested enough. And I think that's one of my strengths. The other thing they said, that's this family, is they said, you were funny.
Yeah.
And that made a big difference that we knew we would laugh. Now, I'm not saying funny has to be a part of every session. But for me, I know humor's one way I make a connection. And I think then that goes back to how do we each know ourselves and says, what makes me a good person to be in relationship with? I'm dependable. What are those things? I'm curious. I'm compassionate. And then how do we make sure in our own style we bring those into the room?
Oh, yeah, I'm smiling because you're hitting all of these points. And as you were saying that, my colleagues have adapted the work of Martin Buber, the philosopher, who, and it's in this way of being literature, the difference between being I, it, and I, thou. I, it is something we do, as you were saying at first. It's an intervention or a model that we perform on the client. Early MRI, we'd study the feedback loops and we'd go and meet and talk about the clients and come and deliver the intervention. And nobody likes being in an I-it relationship. Whereas what you were talking about, Mary Jo, what you've been saying all along, this I, thou, I'm in relationship with you. I'm being myself. This is a relational endeavor. You were young, you were just starting. It wasn't your clinical expertise or your technique. It was you being real, being funny, being accessible, being in the moment. So that early on, and that's why I said when I've trained at this point, 25 years in my career, probably thousands of therapists. And when I'm interviewing someone and they come in for a graduate day thing, I look, can they be, even if they're nervous, can they be in that I, thou? Can they be in a relationship? Can they be in the moment? Can they be themselves? So you could obviously do that from a very young age. Froma, we're talking about your thoughts on the therapeutic alliance in systemic therapy and how it is multifaceted and complex and how you go about building alliances when you maybe have people with very different motivations in the room, if you have a couple or a family system.
What I've thought a lot about in my career, I do a lot of work with very complex and traumatic bereavement. And I think use of self is paramount. But what does that really mean? It means also we need to reflect on our own experiences if we're going to be able to connect with clients without it triggering our own experiences from the past, because I find that especially with loss and grief. Even when I was writing the book, people would ask me, what are you writing about? And I would tell them and they'd say, oh, and then they'd change the subject. And everybody says, oh, that's so important. And then they walk away. Or people show up at the time of a death and and they come with casseroles and then they go back to their lives. And it it's because, especially with loss and grief, it's our most profoundly challenging experience in the human experience. And we all are going to face it, not just our clients. So it means that if we're going to work with people going through a tough time, it's one thing if I can relate to that or I can have empathy for that. But when it also touches upon something where we have our own mortality concerns, we've lost loved ones or we fear losing loved ones. And so what I've seen for instance, when I do trainings at medical centers, they don't know what to say, what they do. And there was a study where doctors, after they told patients that there was no more treatment that they could do, went past the room, didn't stop by, and patients and their families felt abandoned. And it's really because we need to think more about our own life experience and how and do that in a way that I don't like the word resolution. We don't resolve trauma and loss experiences, but we gradually integrate them into the chapters of our life so that when someone has a very painful or traumatic experience, we don't short circuit and back off, or when they want to change the subject because it's too much, it's too painful, that we go along with them and then we forget to come back to it. So if we are going to really keep engaged with clients, we have to be able to like look back on that chapter, maybe learn more about it, find out more about it, integrate it better so that in fact, I think as Harriet Ponte would say, it can enrich our practice. It isn't just something that we have to get a grip on, but because we have had profound experiences ourselves, we can have presence that is understanding of their experience and yet have more compassion because we've been through our own experiences.
When I've been asking about how you build alliances, the challenge when you have multiple people in the room is there may be some clients that you're able to just naturally, the bond component of the alliance is there to start with. Others, strength and health, or you admire, we'll use one of Froma's catchwords, their resilience. But there's sometimes clients, they are not likable and they are very challenging. Or individually, they're likable. I always say when you see a couple cycle or a family cycle, it looks ugly and very toxic. One of the biggest questions we've been asking our panelists is how you build an alliance with someone that is inherently not likable or maybe even disrespectful. I have 3 strong pioneering women on the panel today, but you are also trailblazers in a way that many times, unless you're working with the same sex couple, there's always a gender imbalance in the room if you're doing couples therapy and sometimes even family therapy. So how do you work with someone that is not likable or maybe even disrespectful to you throughout your career?
That's a difficult question. But over the many years of being a clinician, my sense is that the more I know a person, the more I like them, rather than the other way around. So I have always made a point of maintaining the same level of distance with those that I like, what you call bonding, from those that I don't. And sometimes it is necessary to say something about what you're finding difficult. So yeah, I don't know how much you want stories, but
I love stories, Celia. You tell beautiful stories, please.
yeah, it wasn't that actually long ago at all that I saw the couple. And by the way, I do not equate couples with family therapy. I think they're different color. And in some ways, in my opinion, for myself, it is more difficult to see couples than to see families. So this was a couple, and the husband was an electrician, and his wife was more educated, somewhat of an interclass marriage. And sometimes I would interview each one separately, particularly if I have some issues with one. And so and most likely, the man was not somebody I could agree at all on anything. The way his politics, his approach to the therapy, where he was very confronting of his wife and of me. And yet, when I met with him individually, I found out how terrible his life had been and how much tension there was in his family of origin. And more than anything, how much jealousy he felt about Black people. He was very racist in many ways. And I got interested and which about him as a person, as a complex person. It was like Trump was saying, the complexity of people's lives.
So for this guy, even if he wasn't inherently likable, the more you got to see with him, you got to be, these are Eli's words, you got to be curious about how he got to be that way.
Yes, and what was his present thinking representing? I always look for people's strengths, and one of them was that he played the saxophone. And I could not imagine in my own mind what I discovered by becoming interested in his music. He was interested particularly in jazz, and he was in Facebook with a group of musicians, and two of the musicians were Black, and they were much better than he was. And so he ends up crying in the session, saying, I am a darn good musician, but I am not a good saxophonist when I'm comparing myself. And he became humanized in my eyes. And I think my interest in him humanized me. And because nobody had ever been interested, his wife and him would fight a lot. And of course, she was not a therapist. But by the end, he said, you know what? I really want to be married to you. Like, I want to be married to it. And I go, wait a second. So why? Because I try to understand him. And so I think that one of the issues that we have with clients that we dislike is we don't know them enough.
Yeah. And I totally agree, Cynthia. And one of the things is that I don't know that I got taught, and maybe you two could share, but that's exactly was going to be my answer. If I really am sitting with someone I don't like, I have an individual session with them. And that was not something that ever even crossed my mind. And as a younger therapist, I almost felt like I was breaking some kind of rule, like having an individual session. But as I learned about the piece about connection and the hierarchy, which I said earlier, that is a way to flatten the hierarchy and create that attachment. And that's exactly, if I'm feeling like I don't like somebody, one is I give myself permission to say, it's okay that I am not crazy about this person. And then I schedule an individual session. And I just started it the other day. I just had an individual session with a wife that I really was getting into a lot of conflict with in the session. And the only thing in terms of that I would want to add is that for me, if I'm going to have an individual session with somebody, I try to have them then with other family members, even if I don't have the same motivation. If it's not about, oh, I want to get to know you better or I want to get a connection, that to me just feels that if I'm going to have an individual session, I don't want someone to feel, am I the problem? So that is just something I'd want to add, is that I do have a lot more individual sessions than I ever thought I would. And usually it's with that intention.
Yes, as we say, you can be the family therapist and change the session format without changing the modality of family therapy. You can have an individual session, individual plan feeding into the family plan. You know what I was going to ask you, Mary Jo, because I'll probably reference this towards the end too, but my first ever encounter with Mary Jo, I was 23 years old, fresh graduate student at Northwestern, the Family Institute. Mary Jo was coming in, and I believe it was a special populations class. And she was talking about what I would think was the hardest thing to sit with in this trauma, but in this case, family sexual abuse, where many times Mary Jo was seeing very challenging systems where the perpetrator was a family member. And while that had not touched my personal life, I thought a 23-year-old Eli, I don't think I can sit in a room with somebody that has sexually abused their child. I'll put you on the spot, Mary Jo. How did you, from such an early age, learn to do that and hold space and find a way to work with people that really, on the surface, did something that many people could never forgive? violating a child that way?
Again, from my clients, because my early experience was with incest or with a beloved family member who had sexually abused, whether it was a sibling or an uncle or a priest, or that I realized it became very clear very early on that people wanted the abuse to stop. They didn't want an end to their family, and they did not want to cut off. They did not want to end the family. They could hold that dialectic, right? They could hold, this person did a terrible thing to me, and I love them, or I care about them, or there's other positives. And even the spouses, like, people used to say to me, how can you sit with somebody who will stay in a marriage where they've been beaten, or that and again, some of it was, if I didn't, I wouldn't have enough money to feed my kids, or so. And so then that got me. If they have that and I'm really going to be of service to this family, I cannot come in and have a different agenda or view. And so then the next step was, I got to see what it is that they care and love about this person. Then what followed up with that, Eli, is that as I really did become intimate with sex offenders, and not in a sexual, intimate way, I realized they don't want to offend any more than we want them. The percentage of people who physically and sexually abuse their children are not sociopaths. They are character disorders. And I know that's hard for people to believe, especially in this day and age, but that so the treatment isn't about treating a character disorder. When it comes down to it, they blame the other person, because they can't tolerate living with themselves that I'm the kind of person that would do this. And so once I got to know that aspect of who they were, it was easier. It was easy to care for them. But most of the time, it's our own being repelled. And so again, I had to work past it. And I'll tell you one other thing, and then I'll stop talking. I also had to get past how poorly I was treated by colleagues, because colleagues
Treated by who?
colleagues like you
Colleague.
that I was maintaining an abusive situation, and didn't I know that I was being manipulated by, and that was really difficult too, because for me to stay in relationship with somebody who offended was not easy. And then again, that made me understand the families better, because then somebody had to understand why they wanted to be in relationship with people who offend. And that's what I did.
Yeah, you've made a career out of doing that.
I definitely did a career out of it.
And you started your career with, again, one of the hardest populations I think most of our listeners would ever think to encounter. Froma, your thoughts on building an alliance with somebody that is really challenging?
I would talk with all of you all day long. It's just, I think something I rail against a lot is that our culture in the United States, and there are few other pockets of this, is so individually oriented. And we go through cycles, and some people will say, oh, the era of family therapy is over.
Yeah.
No, this idea that and now it's like you get your individual therapist. And the example that Celia gave would be too often, and this is not true in Celia's instance, but it's much nicer to go to your therapist and tell your version of the story. And everybody else, you're the victim of these parents or of this spouse. And then the therapist is so understanding. And then you go home to your spouse. And so you leave that spouse and you get a new one. And so I think it's not, and I know we talked about family therapy is not a modality, But we have to keep saying that it's a systemic orientation where we hold individual, couple, family when we're asking questions. We want to know, yes, this happened to you. And yes, you're the one that's suffering the most. Tell me how it's affected others. How are they supporting you? And if that's not happening, I don't want to be the only one that is understanding, is liking the person. I have to also make an attempt to reach out or to coach. And I think that's where we could use much better use of coaching that comes out of the Bowen method. I know Monica McGoldrick and her colleagues do family therapy with individuals all the time because we think about, okay, now when you go home, and it's not that different from maybe giving homework in structural family therapy, that we pay attention to what's happening after they leave our session and we track that when they come back the next time. Because I feel like I hear in the media, and I don't know, we're old people now, but it seems like there's a new swing of the pendulum back to just get distance from the family that hurt you or wounded you. You don't need to make amends with them. You don't need to repair. Just go out and live your life. Put them behind you. And I think that's really a tragic mistake because we all carry that within us and we'll take it into other relationships and life pursuits, our expectations, our fears, our barriers that we bring. So I think when we are working with individuals, can I give an example of this?
Please. Yeah.
Because I recently did a book on loss, when I was invited to do a state affiliation, they're now called, of family therapy or to do the workshop for the year. And they said, oh, we really could use resilience. And I said, also, I'm doing this new work and of working with profound loss in families. And the person that replied to me, wonderful colleague, said, I think we'll go with the first one because if the title has the word family in it, people come. And these were MFTs.
Yeah. I don't like hearing that. I mean,
Yes, I don't fault the person who said it out loud, but that is where we are. And I actually took the word family out of the title of my book. Even though if you open the pages, you can find it there because we're relational creatures. And that is the way I think, that is the way I work. But I do worry that MFTs and psychologists who, whatever we call ourselves, relational or systemic or family psychologists, that we may work primarily with individuals or with couples, but it's a back and forth of the individual work and how that gets translated and supported, or where there's barriers in the couple relationship. It can be a consultation, it can be a meeting, it can be whatever we want to call it, without having to say, oh, now we're going to switch to couple therapy, or now we're going to do family therapy. It's just good therapy.
yes. Another thing that differentiates being a systemic therapist is being able, as we've already said today, to expand the system when necessary, to bring in other important people from what we call the indirect to the direct system in order to do the work, in order to create the connections or to lift the constraints.
I was presenting for a conference in Brazil a couple of years ago, and I did a live interview with a family where the wife had lost her brother and he had died suddenly in the middle of the night, a heart attack apparently, and she was inconsolable for now months. And so I saw they had the husband come in and with the wife, and they sat minutia. I like to learn and draw from every method, every model in family therapy. I'm an integrative therapist where people sit in the room. And the wife is the patient. She's been seen for several months. The husband comes in. He's a little awkward, looks like a nice guy, and he pulls his chair a little bit toward the door. We observe that. I worry a little bit now about everything being therapy online. So we'll talk about that, I hope. So he said, I just feel helpless. I don't know. I can't solve this problem. I can't bring back her brother. I don't know what to do. He was a construction worker and he was like hands-on. You build things, you fix things. I don't know how to fix this. And so it made him feel helpless. And that's a gender thing where men are more maybe prone to feel like they got to solve the problem or they don't know what to do. And he wasn't that comfortable showing emotions. And so I said to her, how might your husband support you through this hard time? And she looked at him and she said, just hold me. She said, I already lost. And then he pulls his chair in, he holds her. She sobs in his chest. And he's not so comfortable with this. He realizes that that soothing is what she was needing from him. She said, you don't have to say anything. I know you can't fix it. This is not a problem we can solve, but I need you. I already lost my brother. He was my older brother. He brought me through hard times when I was growing up. And now I rely on you. And you're just not there for me. And I'm afraid I'm losing you too. My message is we can be doing really valuable individual work, but we gotta make sure that gets translated into a supportive relationship.
Yeah, what you were saying, it made me think of part of the skill of a master systemic therapist is knowing when to be direct and to be able to create an event, facilitate an enactment, and then knowing when to step back and let a moment like that happen that you just described. I don't think we do enough training on how to prepare our young systemic therapists to sit with grief and loss. I know probably all of us have had to sit with very difficult things we've already talked about early in our career. But I am curious about that because I think as I am now 25 years into my career and still love clinical work as much as I did the day I started. I remember I've talked about it on the podcast many times for the reason. First time I met an MFT, I didn't know what it was. My father had a massive heart attack, passed away after I graduated from high school. It was a traumatic event in my life. And that's the first time I'd ever heard of family therapy or done anything like that. And then early in my career in Chicago, I thought I was going to have this nice, cushy experience in a clinic. And half of my placement was in Cabrini Green, one of the most infamous housing projects right next to all this affluence, as you all know, in Chicago, and working in a community center. And that's not what I thought therapy was like, and people that had lost their family members to horrible acts of violence. And I just remembered just sitting with people was
Hard.
Yeah.
Yes.
So you already, I mean, Froma, this is your jam, but we've all had to sit with very challenging situations and I don't train you to really do that. It's not in the textbook how to hold space and be therapeutic by just being a container. But I know that's so important in the work we do. I'm curious your all's thoughts on that.
I think it addresses the intimacy of doing family therapy and being a member of the family, even though with different boundaries. And I think it also addresses that this sitting with loss, sitting with what I often call the terrible knowledge that this happened in my home is not something that not only are we not trained to do, but it's not part of many of the cultures. It's certainly not part of the culture, certainly a white culture or an Anglo-European culture, that if we look at other cultures, there are rituals for sitting. And even like sitting Shiva, it's still only 7 days, but it is that concept of sitting with it. And so I think it's about us being comfortable as clinicians, again, with sitting with people And I do agree with you, Eli, that it would be an important thing for us to teach. What is your tolerance to sit with terrible knowledge, with terrible pain? What's the benefit? How is this in fact healing? To do nothing but to be. That in fact is healing. And that is something we could learn from so many other cultures, to be able to see the healing of just being in community. And I think what we're all talking about is right now, we are a me versus a we. And if you think about, and I will try not to get too political, although that's not very much where I'm at right now, is to not be political, but everybody's talking. Most people talk about the only solution to this place we find ourselves in our history, is by community organization. So being in community is going to be, if we will heal and solve this, which of course I'm saying we will, God knows how and when, it will happen in community. If there will be change, if there will be healing in our country, it's going to happen in the context of us being in community and sitting with the terrible knowledge of what's happening, sitting with it, and then and then doing systemic work. So that's what we do on a micro, but that's also what's going to make the healing and change on the macro.
Yeah, it's an isomorphic process for sure. It's a parallel process.
Can I just add to that? I know one of your questions is about hope.
Yeah.
And I like very much Kata Weingarten's work
Yes.
on hope, about reasonable hope. Like when people are in despair, and we have to be careful if we are going to open it, that we can hold it and not sink into it, because hope is something, she says, you have to practice hope. You don't just hold it. And that's can lead to just a passivity or a victimhood. And it can make us feel like there's nothing I can do to help. And I think helping people reorient hope, to find ways to hope, to with a partner or family, others who are more hopeful, who can help lift them out of despair. So it's an active process, and we just have to be careful to get, it's always both and if we're systemic, to just be thinking that way.
I completely agree. Now, I've been working now for 17 years in a community setting. It's a community between the university and the local neighborhoods. And then the issue of hope is something that we use a lot in Wilson's work, that is really very useful, because he works in medical settings as a psychiatrist. And I think you may be all familiar with Wilson's work. And he really does great work, I think, in terms of drawing out of people hope, out of families, asking them questions like, have you coped with adversity before? And many families that are poor and they're immigrants, they have coped with enormous adversity throughout the years. And so finding out what they're good at already and how they help each other is assessing their resources, is asking them rather than offering. Sort of the idea that we have to be hopeful in relation to your despair, you have to remove it, you have to depend on your faith community. But I think people have it in them. Otherwise, they would not even come to therapy if they don't think that there's some avenue out of grief, out of being demoralized by chronic illness. And so, from what sources does one grow hope? One shouldn't assume, right? One should continuously ask that question. And on difficult days, what keeps you from giving up? And who keeps you from giving up? Who wants you to get better? So who inspires you to persist in the face of adversity? Those are, I think, questions that draw on people's internal resources and external too, because sometimes, well, like Bill was saying, it's in the community, right, that the resources exist. But I personally work a lot with asking people to continue to do what they're really good at, rather than, because that is a healing of resource that we all, I think, have, or what has worked well for them in the past. So I think the continuum hope and despair is a very important one for therapists to learn more about, because it also moves one away from deficit models.
And that's what I was going to say, Celia, is that if we take the thread of all of us, one of the things is people come into therapy expecting to feel bad or worse in some ways, that we're going to find the deficits, right? The vulnerabilities, that we're going to do the pathology, right? And so if our lens is how do we create hope together, just that creates a shift, right? That just there. And again, that's got to be that the therapist goes in with that intention. That intention is, how am I going to use your, meaning the client's resources, my resources together to create this change, this hope, this healing. And again, I go back to, I think people come into therapy not expecting that.
Right. They've been demoralized, and it's our job to help remoralize them. And I fall back to my friend and mentor, Dick Schwartz, talks about being a hope merchant, but you have to buy it to sell it. So I never lose the opportunity. If something makes me hopeful, back to this I-thou way of being in relationship, I share what makes me hopeful about the people that I'm with. And that's part of feedback too. But you were going to say, Mary Jo, what if somebody asks you, oh, this world we live in now, this is going on, the president's doing this or that. This is the most polarizing time and I can ever remember in my almost 50 years of life. And again, sometimes that it is challenging because again, if you have to buy it to sell it, you have to find something to be hopeful about. So since you brought up these more macro influences, how if somebody starts venting about that, and if you agree with what they're saying, how do you pull some hope out of that?
Or if you disagree, I got
Right.
to do. It goes back to it, when being totally transparent. It goes back to what Froma said about coaching.
Yep.
I have found myself in these last years being more self-disclosing than I ever have in my so what do I do? And we could maybe bring this up. I share with people very directly how I get by. How I get by every day. What I literally say, this is what I do. I share Substacks with people because I'm very focused on the positive Substacks that I read. I tell people as we're talking, I tell them that my goal is to go to at least a protest every single week. And I'll travel to find one. So I have found myself being more disclosing than I ever have in my life, and more directed. Like I said, sharing literally, might want to read this. You might want to look at this. Again, according to what they're asking me. I'm not just, but when they say, what do you do? I tell them what I do. And the other thing is that I've written up a couple of the journaling. I'm doing very focused journaling now every day. And again, if people ask, I share the prompts that I use. I look at it as a coaching more. I'm really coaching people now how to get through, because it comes up all the time. I would love to hear from and Celia's answer back to the question about what's going on in our world today and how it's coming into our therapeutic
Wow.
into the room. First of all, I want a little validation, but second of all, it is coming in that now. It's coming into the room. It's coming in. People are calling me for consultation. What do you do? What do you do when you're sitting with somebody who has very different views? And it's not just different views of it could be different views about Israel. It could be different views about anti-Semitism.
And overlay on that, as you respond to that, imagine you have the two people yesterday that they love each other, but the couple, they're diametrically opposed politically.
So what I'm really is our use of self in that. I want to hear what they
Celia?
Yesterday, I attended a webinar given by lawyers and experts on immigration. So as a therapist, I feel I need to understand what the population of clients is going to be informed, right, about what their rights are and what elements we have that we can transmit to them through pamphlets, through different websites, different apps, actually. And so I feel that it's important. Like, for instance, I subscribe to Robert Reich's Substack, and I learn a lot from him every day. And I try to be informed about the topic because people do turn to me. But there's also my knowledge, it goes to other things too. For instance, the president of Mexico. And she has a very short YouTube of about 5 minutes in which he says to the immigrants that are probably going to be deported, Mexico hugs people. And she does it this way and tells the possible deportees what's going to happen if they're deported back. How Mexico is going to hug them with giving them an avenue to find jobs, about some money to survive temporarily, 2,000 pesos, which is really $200. And so I feel that at this moment, even though I have now for many years not been a directive therapist, I offer those resources if I think that they can be helpful. The other one is something that I have learned in the clinic, some techniques. If you ask about the value of techniques, I could say that one of the techniques that we have used for a long time is to talk about fear, to talk about how can you tell us more about your fear. If your fear, what does it look like, your fear? So people might say, it looks like a red balloon that is going to explode on my face. And so what can we do together to change the size, to shrink the balloon? Can we do anything about changing the color? Close your eyes and see. And this is with the entire family, 3 or 4 people saying, we're very afraid. So what does the fear look like? And use a kind of imagination to cope with it. The other one is to talk about tears, about sadness. And recently we had, which is very typical, a grandmother who wanted to bring the grandchild to the clinic. The clinic doesn't see children, but in cases of family therapy, we can decide to bring the children or to do after hours. And so after school hours. And so the child is very concerned about the grandmother. And the grandmother doesn't want to talk about it. The best way is not to talk about it. And so during the session, we encourage the child to talk about it, to talk, what is it that he's afraid of? And then we say, it's that you love your grandmother very much. And so your tears are pearls of love. And the grandmother then understands perfectly well that she has to make the child come about the tears that he's showing. And so that's how we are dealing. I don't know if that answers the question, Mary Jo, but we're dealing it at the relational level and at the personal. How does this affect you? It is not just an ideological matter. It is a matter of survival. Okay.
Thank you.
I think a big problem is that things are happening so fast, and I can't bear to hear the word unprecedented anymore. What's happening is immoral, it's cruel, it's destructive, and it needs to stop. And that's how I feel about it. And I'm not doing therapy anymore. I've closed my practice, but I do training, I do consultation and workshops. And I think I'm a great believer in the obvious that everything is local, and that because I believe we're talking about dealing with intense and traumatic emotions and situations where people tend to feel helpless. And when they don't know what to do, they pull back, or maybe they seek some kind of relief, or spend all day on their phone or whatever. And I think I work with people in consultation that are addressing different local situations. And if I can support, and I'm thinking of, again, of Kata's program, Witness to Witness, if what we can do outside the therapy room, since we're systemic professionals, it isn't just therapy, but it's out in our communities. What can we do at our local level or in consultation, supporting those who are on the front lines? And in our case, in our family, our daughter, Claire, is in international humanitarian relief in conflict zones in Ukraine, in Gaza, in Sudan, in Ethiopia. And so the one particular arena that I've been giving my attention to is this buzzsaw of destroying all of our international aid, international support that has ripple effects. It isn't just USAID getting shut down, but every international humanitarian program is an NGO, meaning it's nonprofit, and it relies on government funding. How do they now cut back on programs, decrease staff? How do you support the morale of people who are out there trying to deal with what has happened in their particular sector, whether it's special education, whether it's Medicaid? That there's something that each of us can do that can not get overwhelmed because there's so many things happening.
Yeah.
And pick one that affects a particular community that you feel a particular connection to. Throw yourself into it. Support those who are on the front lines if we're not on the front lines ourselves.
What we do, again, working systemically, as we've mentioned multiple times already in our talk today, can extend outside of the therapy room, facilitating larger community interventions. And I do think that is needed.
And now that we have the benefits of online virtual training, we can reach. I do trainings with a special doctoral program in Istanbul that focuses on working with trauma situations. And my particular one is, what do you do when a whole community has collective trauma? The work of Jack Saul. There's an area that each of us can give our hearts to and give our expertise to.
Yes. The more I think about this, I know I'm preaching to the choir. I was someone that always thought systemically before I even had that language. It's hard to think of what's the argument against thinking systemically. But as you were saying earlier, Mary Jo, people come in thinking they're going to be pathologized or they're already on guard. And I think somebody that sees strength and health, again, they're not going to ignore pathology if it's staring them in their face, but they're going to find how to tap into these collective strengths, find how to be hopeful. One thing I could talk to you all day, but I got to ask you all, what has been the most interesting question so far in these panels of All Stars? Therapy is a failure-driven progression. Even the experts mess up. In fact, we try something, we read the feedback from the client or client system, and we take that in and we do something else. So what is the most impactful feedback that you have gotten from a client? And what did you learn from your own therapeutic fails to move forward? Because I think it's reassuring for a young therapist to see these experts and people they've read about in textbooks and seen in videos that know that, hey, that's part of the learning curve, tearing and repairing, adjusting, correcting based on the feedback you get from your clients. Most important feedback you've gotten from a client system over your long and illustrious careers, and how did you fail forward and pivot after a miscue?
One that comes to mind that I think made a lot of difference in the way that I think about culture in general, culture and sociopolitical lenses, in a situation that I had with a Black lawyer from San Francisco who was coming to be interviewed for a job in Cali. And he was interested in having couples therapy with his second wife. And that he came to see me for that purpose. And he was going to bring in 2 weeks later, his wife. And because she was having reservations about moving, he was also, I think, the lawyer. And so during that first session, I started to inquire about the marriage and about the fact that this was the second time that he was marrying a white woman. And within, I don't know, 5-10 minutes of my asking that question, he got extremely angry at me and said, "So you just see me as a Black man that doesn't have the right to learn to love other people. I fell in love with both women, and you're not taking that into consideration." He then said, "Are you saying you're the kind of person that thinks Black people should understand jazz and honky-tonk blues, and I don't have the right to hear classical music?" From then on, she didn't come back. And I think that I learned to always, in all my workshops, to say, your priority as a therapist is to get involved with a presenting role. If you bring culture or oppression or intersectionality or whatever it is early on, and without integrating it with what your clients are telling you, you're making a mistake. You first always hear what is the pain or the suffering of the personality or the system in front of you. So that was, I cannot forget. I cannot. And like that, I have others that have taught me perhaps how not to be. So I can tell you very briefly about that one because it's also, I became a widow fairly early in my life, and I was 47, and I was giving workshops, different things. I met two of my clients, a couple, on an airport, and I sat separately. And the people came to my session, and particularly the wife got really upset with me that I sat separately, that I wasn't empathic, and then she said, maybe you shouldn't be doing therapy right now because you are going through a lot of your own personal trauma, People knew that had young kids and I was raising 3 young kids. And I couldn't take it. I was about to start crying myself. So I got up, opened the door, and I said, "I am very sorry. I cannot deal with this right now." Correct. Maybe I shouldn't, but I don't think that's the case. So I let them go. Afterwards, within 3 days or so, I called them on the phone, reminded them if they wanted to come to the next session. They did come. And then what she said to me, it was terrific the way you responded to me, because it means you are not perfect. Up to this point, I thought you were perfect. You have a perfect countries, you have a perfect this, perfect that. And so it taught me that sometimes make a blunder, or what you think it's a blunder, it makes you more human, it makes you more accessible, it makes you less therapy, less professional perhaps, because within 15 minutes of the session, I opened the door and I said, leave. And so it gave me permission in a way to be more real. Did I answer your question?
Yeah, both wonderful stories. Perfect.
Okay. All right.
For me, I was writing things down, is that I learned from clients, but I also learned from my history, the thing that the biggest message, and what I still to this day am constantly saying to myself, is one of the a couple of times clients have said to me, slow down. You're moving too fast. You're thinking too fast. You're talking too fast. And I remember, and it's so fascinating for me because this is also where you're talking about all stars, but we're also talking about women in their 70s, is that I also learned, I remember when I was either in college or high school, that I would say to myself before I would go to parties, count to 10 before you open your frigging mouth. Because I was always either talking too much, saying something I'd regret. I remember telling myself, I knew that was a problem for so long. And just recently, we don't have to get into aging. I don't know if Celia and Froma would agree with me, but one of the things I've observed as I've aged is my filter's getting a little thinner or something. And I've noticed that I'm talking a lot again. Hence, probably you're all saying, yeah, that's for sure. You've been talking a lot this last. And I'm saying to myself before I go into sessions, literally writing notes on saying, Mary Jo, watch how much you're talking. Watch how much you're talking. And I had a client last week that said to me, boy, you're really quiet. Is everything okay? And I said, I've noticed I've been talking a lot. And then as I was saying that, I said, hey, you're saying too much. So that's one of the things personally that I've had clients say to me, but I've also said it to myself. And one of the things, if in my last book, I have this at the end of every chapter, I have what I write, pause and ponder, because I sit in sessions and I say to clients, you know what, let's just pause and ponder what just happened. What you just said, what I just said, what just happened between you. And I would say pacing for me is like being able to pace, experience what's happening in the room, pausing. That's been the lesson. It's been the thing I think I've worked throughout my career.
My problem is I tend to want to tell a story and then I go on too much. The older I get, the more it happens. And actually, years ago, I was in the Middle East. My daughter was working there and I got invited to do a workshop. And so she had never really come to my workshops before that, but she happened to be working there. So she sitting way in the back and I was going on. And all of a sudden I see in the back of the room, move it along, invisible. Yeah. But I think all of this makes us more human. And maybe we mature into more of ourselves and more comfort with just being ourselves, for better and for worse. I wanted to share, when you asked about a failure in therapy, my first thought was it was my own therapy. My mother died when I was 28 and I was in my second year of training. No, I'm sorry, my first year of master's level clinical training. And I was in New Haven and my parents were in California. And I, what are you going to do? I had a scholarship. I couldn't just quit and move out. And I didn't know she was dying. And then she died. And then I had to go back, just get right in and see everybody. And I handled it all. And it was really like a mistaken idea of bouncing back and being resilient because I just pushed it all away. And in those days, I'm a grown up and my mother died and okay. And I came to Chicago and I really found I was very troubled by her death. And I wanted to go to therapy for it. And this was in the early 70s. And so I was the family therapist in a more psychoanalytic setting. And so I asked my senior colleague, and I thought, I want to see a woman. And because I think it's about me and my mother. And so he said, she's the very best in Chicago. She was a psychoanalyst, highly respected. She saw a lot of the residents. So I went to see her in her big office in her apartment. And I saw her twice a week for 2 years.
Hmm.
And throughout the whole time, she sat on the opposite end of the room like a psychoanalyst. She wasn't, it wasn't psychoanalysis. I wasn't on the couch, but it was psychoanalytic therapy. And she asked about my mother and then more about my mother. And the more I told her, the more it became pathologized.
Mm.
And my mother, bless her heart, God, she worked so hard to keep our family together and to support our family and to love well and to do her best. And it was really hard. But the therapy, every time I would give an example, tell me more about your memories. And she would say, your mother was obviously a narcissistic character disorder. And that's because my mother was a piano teacher and occasionally gave performances, and I'd be in the audience. No, my mother was, we found out much later, she had actually been a nun and she was like very selfless, if anything. But it was like the power of the therapist to over time erode all the positive memories of the mother I loved and hadn't really grieved until I saw her as this uncaring, narcissistic character disorder, and everything got negatively connoted. And I think, and fortunately, right after that, I changed and I came to the Family Institute and I asked to see Jan Kramer. She
Yep.
was with Chuck Kramer.
Yep. Stuck in jail. Yep.
Yeah. And I said, I need to see you. I think maybe about 10 sessions. I just have this. I need to work through this. I bawled my eyes out for 10 sessions. And I said, I think we're done. And it was like, I had to undo all of the negativity and the disparagement that colored my whole view of my mother. And I think that's where maybe one of the soapboxes I get up on in my career is against the pathologizing in the mental health field and the over focus on what's wrong. If we go to families, then okay, it's not the mother, it's the whole family is toxic. And they're all participating in it and unable. And maybe that's why it really pushed my whole career toward strengths and resources and seeing what I came to see was the enormous resilience in my parents and in all the adversity that they faced in their lives. And I think it propelled me in the direction I went professionally out of that. No, we've got to rebalance it.
Oh, that is a gem of a story. Your whole career trajectory changed for that. And what I take away from that is we talk about again, a strengths-based profession and seeing health even among the most challenging situations. But I think the worldview matching, you have to pick a therapist that has enough of the same worldview, because that psychoanalyst obviously thought by pathologizing your mother, that would give you what you needed, but it was the opposite of that. So you had enough wherewithal to shift, find someone that you knew had a different orientation, and then give you what you need to help you do that delayed grief work, which really propelled your whole career. But yeah, that's
Then as our field then began to shift, not just to strength-based, but to understanding these deterministic theories, if in our practice or in our lives, that we have to be very careful not to impose those on our colleagues, that we're bringing ourselves. And Celia, you do this, write about this beautifully about the engagement, and that we have to understand our clients in their life situation. I had to know my parents' whole lives to humanize them. They weren't just the parents that I had in my childhood, but they'd come through enormous challenges before that affected them, of course. And until I could expand beyond the strength-based to understand their lived experience, that changed everything for me.
we have three very accomplished leaders, female pioneers in the field of systemic therapy. We didn't talk about model specific language or any specific technique. We talked about the therapeutic relationship, the alliance. We talked about tapping into our clients' strength and health, tapping into hope. I like to end with talking about these therapist factors, things that are inherently you, they cannot be taught. And anybody listening to this or watching this can tell three very different energies. That's why I love the asking people to pick a panel. Who do you want to talk to? People you respect, people you've known a long time. So you all have known each other a long time. I wasn't going to do it. Mary Jo dated you all, but that if it makes you feel any better, I was exposed to all of your work in the same, Northwestern was on quarters. So the same quarter, I was 23 years old. And now as again, are a few years shy of 50, I reflect back on my 25 years in this profession. And what I love about this profession, it is not pharmaceutical sales or an athlete. You can age in this profession as long as you do what you all have displayed in our talk today. You are self-reflexive. You are thoughtful. You solicit feedback from your clients. You can age into this profession. And what comes with that is wisdom and still a great love for what you do. And Froma, even though you're not practicing anymore, you're still very active. You're consulting, and Mary Jo and Celia are still very clinically active. So I want you to look at your two other respected colleagues here and tell them what you see in them that is authentic, that you appreciated because you don't have that quality, and it comes through in the way they show up in the therapy room, outside of the therapy room, as a leader and advocate for this profession. It's really been a beautiful way to end. So if you could acknowledge one of these inherent personal qualities about your colleague and your friend that you really admire.
Mary Jo, I admire your bravery. I wish I was as brave as you are.
Thank you.
I'll piggyback on. I think that showed up when I was here. I was a young person. I saw Mary Jo was talking about doing this work, as I said earlier, and fearless. And Mary Jo, when you started doing this work, you were in your early 20s working with these families that were much older and very constrained. But yes, there was a fearlessness about you that lets you own who you are, lets you speak up, which you've said today. And sometimes our greatest strength, if we don't regulate it, as Mary Jo told us, can also be a detriment, that the talking too much. But Mary Jo, I don't think you could be any other way. And that certainly is something, the way you show up in the therapy room, almost positive, is how you show up outside of the therapy room. Is very authentic and consistent.
Thank you. Thanks.
I can second that, Joe, before you respond, because I always thought about you and the way that Froma described you as very brave and taking on very difficult human interactions and be able to be very caring at the same time. So I would think You're both brave and caring in your breathing.
Thank you. When you're right, Eli, I wasn't expecting that question, but I love the question because I love taking the moment to think about the two of you, pause and ponder.
Yeah.
Even though we are in the same decade, both of you were my teachers as well. And Celia, I'm going to cry because obviously, I think I knew I was so much more exposed to you than, in fact, you were with me, because I was at IJR and I was just starting in my relationship with Irv. And I always, you're kind and present and emotionally holding wisdom. Like it was my experience of you, and that you so kind and so wise and so mindful and thoughtful that it was, for me, it was a huge inspiration. And it was so great. I often think about you, which, probably surprises you, but watching you do the work and saying, I want to be able to access those those parts of me, because even though I don't look like that or act like that, I also know how beautiful and healing that is. And so just that energetic experience of kind and wise, it's always had a huge impact on me. And Froma, I modeled much of myself after you as well. That I just saw you, I see you as such a leader in our profession and such a great teacher. And again, I'm not that much younger than you, but it was, Roma can get out there and teach and have confidence and feel confident about that she has something important to share, and that you're inspirational, and the way you share your knowledge graciously and so giving with your thoughts, and again having the confidence that I have something important to say. And your voice in the field has been hugely influential, and personally, that I just always want to hear what you have to say.
Well, let's have a drink. Sing.
I say,
Well,
Down the street now.
graphically close enough to do that.
Yes.
Here, since we were going out of order, I'll piggyback on. From really also what I admire, she links the past, present, and the future, I think, of systemic therapy, and had an input and an influence on all of them. We even talk about, I could talk to Froma for 2-3 hours about the women. Was sitting with Betty Carter and Monica McGoldrick and but Froma has been on the
Put her on the block.
Yeah. And spanning, again, these ideas of spiritual reserves and resilience. Without Froma Walsh, we don't have that. She does care. And everybody in this room is not doing it because they need to. They're doing it because they still love to. So Froma's talking because she is a wonderful teacher and trainer and still loves doing that. And Celia, I'd heard so many, my Chicago roots, I had never gotten to meet you face to face, but when I found out that, no one has ever said a bad thing about you. You were often requested to be on these panels, so it was wonderful to have you. And then I realized that it's not written about in the history books. It should. IJR, it was an incredible place. And even though that was before my time, all my mentors and trainers have some connection to there. And to know it, you ran that place and how many really challenging personalities and egos that you manage. It is very consistent in how you've presented today and everything with your quiet confidence and, again, your authenticity. And I think you led that group, much like you probably conducted a therapy session. So it's very much a parallel process. So I respect that about you.
I want to get feedback to Celia. Okay, but this isn't feedback. I'd rather tell how we met. We met on a doorstep. I was visiting my best friend from Peace Corps days in Chicago when I had moved to Chicago, and she was visiting her friend who lived on the first floor. So I came down the stairs, and my friend said, "Oh, you might like to meet my neighbor. She does something about family something." And she was actually the videographer for Carl Whitaker at IJR. And Celia was at IJR and was like, "Really?" And so we had just each tried to submit our very first article. Celia, it was your dissertation, I think. And I had an article that was rejected by a psychiatric journal, a psychiatry journal. And so we decided, and our other friend wanted to write an article. So we decided we would meet once a month. This was in 1975.
Wow.
And we decided we would get together once a month and read each other's work.
Oh.
And it wasn't like a hold your hand support group, but it was like really good feedback. And we each published our very first article in Family Process. It was in 1976, and you've published your dissertation paper. And and then we realized that we had these connections, both as family therapists, but also we had come out of the same doctoral program at the University of Chicago in human development, although we just missed each other and hadn't.
I'm a little older. So I finished, I think, 2 years before or a year before, but we had all those conversations. And we have become, sisters.
We still send our papers to each other and we ask each other, what do you think about this? And I can't.
We're invited to do something. My best advisor is Froma. I got you.
Again, we'll end where we started. We are relational by nature and relationships matter. And you can see that holds true. Again, I can't thank you all enough.
Thank you, Eli.
Thank you for putting it together.
Eli, back with you, bringing to a close another amazing installment of the All-Star Panel series of the AAMFT podcast. Hearing from Froma Walsh, Mary Jo Barrett, and Celia Falicov together feels like we're sitting in the presence of wisdom, compassion, and courage all at the same time. Each of them has devoted a lifetime to helping families find strength, not by avoiding pain, but by walking right through it with grace, love, and meaning. Froma's voice reminds us that resilience is not about perfection, it's about connection. Mary Jo shows us that trauma can be transformed when we create safety and compassion in the room. And Celia invites us to hold culture and context at the center of every story we tell and every healing conversation we enter. Together, they truly embody the heart of systemic therapy. Hope in the midst of hardship, meaning in the face of loss, and the power of relationships to restore what has been broken. If you've enjoyed these all-star panel conversations, be sure to check out other episodes in this special series featuring the trailblazers and the innovators who've defined our field and those carrying it forward. If you've enjoyed today's conversation, pass it along to a friend or colleague. And remember, there's now 7 full seasons of in-depth interviews, thought-provoking discussions with the biggest names in our field, all available in our podcast archive. Make sure to follow the AAMFT on Facebook, Instagram, LinkedIn, X for the latest updates in our profession. Please subscribe to the show, leave a review, let us know what you want to hear next. To connect with me directly, visit elikaram.com. That's ELIKARAM.com for free resources, speaking info, and more. If you're looking to grow your clinical skills or pass that pesky MFT exam, check out my 2 latest books, Marriage and Family Therapy, Official National Exam Study Guide. It's a comprehensive evidence-informed guide designed to help you conquer the AAMFT RB license exam with confidence. It's got practice questions, exam strategies, and insights from yours truly. Bringing common factors to life in couple and family therapy with AAMFT president and my co-author Adrian Blow is written to ignite your energy and creativity. It offers a practical roadmap for using the common factors to enhance your effectiveness, reduce burnout, and revitalize your systemic work, whether you're a seasoned clinician or you're just starting out. Until next time, my friends, stay safe, stay curious, and most importantly, stay systemic.